best self. That could be an issue. I would say mostly you're not stimulating yourself, you're socially isolated. There are connections to, some connections to individuals with diabetes. There are some connections to people with massive depression. Alzheimer's was misdiagnosed as depression for many, many years. So all those are contributing factors on some level.
Can I just insert something? I mean, the Alzheimer's Association is really committed to uncovering research and information about how lifestyle can impact brain health in later life. And we are a principal investigator in the US Pointer study. And there are 5 locations, I believe 5, around the country. And it's taking individuals who have suboptimal lifestyles and perhaps a risk or a family history of Alzheimer's disease, and really helping their care navigators, helping to improve some of those lifestyle factors to see what impact that might have later on brain health and cognition and memory. So it's a huge area of research right now. And I'm not supposed to ever say exciting with the word Alzheimer's, but the amount of research that the Alzheimer's Association is committed to right now is really very exciting.
I think, Yael, you answered the next question, which is about a copy of the presentation, but so that everyone hears it. Is there a copy available?
Yes, we can share that via email, absolutely. Okay.
And for those that are not email, if you'll send it to us, we'll make sure they get it.
Of course.
Sure. And then as Susan said, we have a presentation called Healthy Living for a Healthy Brain, which includes cognitive stimulation, social stimulation, physical stimulation, and a healthy diet as the basic 4 components. Go ahead, Susan. So again, for those who are caregivers, and when we use the word caregiver, we're primarily talking about unpaid help, often women, 73% are women. Often these are family relations. So this is a spouse, a daughter, or children, neighbors, aunts, friends, whatever your church community members, whatever your main community of support is. But when we refer to the term caregiver, we're often looking at unpaid care provided by someone you love. And most of those tend to be women. Next slide.
Would you like me to launch the next poll? Oops, I'm not.
Do we want to, sure.
So, and then for those of anyone who is on the phone, oh, I'm sorry, I need to launch it. Are you currently caring for somebody with Alzheimer's or dementia? As we all frequently wear multiple hats.
Could you take a verbal poll for those on the phone? Just have them do *6 unmute.
Of course. So anyone who's on a phone, if you could *6 to unmute and provide your answer, we'd appreciate that.
Okay, I think you can end the poll.
Okay.
Okay.
So overwhelmingly, not a lot of caregivers in this group today.
And remember, caregiving you can be long distance caregiving. So your loved one could be living, an hour away, across the country, whatever it is. If you're actively participating in care on some level, it doesn't have to be the day-to-day care. We do still consider you a caregiver. So maybe we should relaunch that poll, but that's okay. Go ahead, Susan. Just a brief glossary, I think we all know, but the cost of care is frankly enormous, and it's all private pay, and there is relatively little to no financial assistance for care. You can pay for in-home care, you can pay for assisted living, but all of that is private pay. And frankly, this disease has the capacity to bankrupt our country if we don't find a way to get more assistance. Susan.
Are you going to talk later about advocacy in this area?
Yes. We are looking, when we talk about resources for support, would like to talk a little about what the Alzheimer's Association does offer. Next slide. So we have a 24-hour helpline where you can reach a live social worker, master's level social worker, 365 days a year at 3 a.m., at 10 a.m., at 11 p.m., whenever an emergency happens, so you never have to feel alone. This helpline is for active caregivers, it's for professionals, it's for friends, it's for neighbors, it's for anyone who has any concern of any kind. You will get assistance any time of day. And you will also get a follow-up call from a representative of a local chapter like myself or Susan. They have all had cultural sensitivity training and are bilingual. You can get assistance in up to 200 languages through a translation service. We can do a lot. You can do a live chat. You can do TTY services. You can contact them via email. However you want to get a hold of somebody, there is support available for you. Since COVID, our virtual programs have really ramped up, but this has always been a resource that's available to you. On our ALZ.org website, you can attend all of our educational classes for free. You can join support groups. You can take the classes as many times as you want. And the great thing about the virtual world is that, let's just say you are caring for someone long distance, you can participate in a support group, you know, in Florida, in Texas, in San Diego, wherever you want. You can get the local calendar of each chapter, so you can find out classes throughout our country. Next slide. We have support groups, which is one of my favorite things to do, is lead a support group. And that's the best way, frankly, to learn new information, to gather information, to create a support network. And those are happening, again, daily throughout the country. So you can join virtually. Right now, everything is virtual, but you can join virtually in the city where someone you love lives. And it's a great way to find when the support groups are happening, and all of our other classes and resources is through our community resource finder, which you can go here, that's the web link, and then you can type in a zip code and you can find out resources in every community across this country, including our programs and events. I believe there is a poll included in that one. So before this webinar, were you familiar with the services and resources of the Alzheimer's Association?
And individuals on the phone can, again, unmute by pressing *6. But as Jackie reminds us, only once. I'll give it another minute or a couple seconds. Okay, so I'm going to end poll and share the results. So kind of overwhelmingly not as familiar with some of the resources through the association. Okay.
Thank you. Next slide. And now we really want to hear from you. We want to share your experiences. So we're going to ask you to get your typing fingers ready and look at the chat. And for those of you on the phone, please share. And if you don't want to chat, please unmute yourself, and we will be happy to call on you. But we really would love for this to be an interactive discussion, because this is where we learn how to become better partners.
So I guess I'll kick it off. If you'd like to add to the chat or unmute yourself, you know, what do most people in your community, within your congregation, describe problems with memory, thinking, or reasoning? What are the common words people use? And please feel free to unmute.
Well, I think it's forgetfulness.
Mm-hmm.
I think people are I have a situation, two of my friends. One is her dad has severe dementia, and then the other one, her mother has dementia, and it's overwhelming. The dad had to be restrained. He was hospitalized, had to be restrained. And the mother, they finally had to put her in a home because they simply could not care for her day to day at home by themselves as she was doing the care on her own.
Yeah.
So, and it's memory loss, forgetfulness. So very challenging situations.
Definitely. Definitely. Does anyone still hear
this is our opportunity to learn, but Ms. DeVoe, if you please know that the helpline is available, and I will put my email in the chat. Please have you or your friend reach out, and I'm happy to, we can create a care consultation. We can do it virtually. We can do it over the phone. Happy to provide support and resources.
Thank you. Appreciate that.
And I think
I think for a number of people, family as well as church members, we try to pretend it's not happening. And so we join the circle of denial. And maybe that's something that people can share. You know, someone has the same outfit on, 3 days in a row, and we don't say anything. We don't try to find the help, or the family member who is forgetful. I don't know if anybody else had this experience, but the worst phrase you want to use is, "Don't you remember?" And that triggers a bunch of emotions. But maybe you can talk to us about how we handle situations when everybody's trying to pretend it's not happening.
Yeah, and I'll start it off, because again, I think that could be another 2-hour listening session. But I think one of the challenges is also, I mean, the words we've been hearing, forgetfulness, memory problems, but it's also recognizing all those other signs and symptoms that something might be going on. So it might be, not changing the clothing, having some communication difficulties, maybe getting lost, getting to church or coming home, even though it's, the same building they've been going to and attending for over 30 years. But
some financial, maybe bad financial choices. Being more susceptible to scams. I worked with someone who said to me, "Yeah, I got this great thing in the mail. I only have to send them $1, and they're going to send me 10,000." So being aware of judgment issues being off is important as well.
I have a. Oh, sorry.
No, please.
I have a question. I remember, and it's been a few years, but there was a video. I attended some type of training on Alzheimer's, but the video was on the progression of the disease, where it took from someone that had first been diagnosed to going through the stages. And it actually showed the stages of what the person was going through and what was the interaction between the loved one and the caregiver. Is something like that still available?
Yeah, so we do talk about that in our effective communication presentation. It goes through best communication for mild, moderate, and late stages. And again, that's something that we're happy to do, like more intensely one-on-one or one to many. If there was we're happy obviously to do a call for the AME chapter, or just presentations like that, or with a family members.
Okay, thank you.
But yeah, there is. Sorry, go ahead.
Still on our website. It's not necessarily I wouldn't call it a video. It's more like an interactive tour of the brain during, say, early, middle, late. And it shows you what areas of the brain are being impacted and what you might see in terms of behavior or changes. So when we send out the follow-up, I'll send you a link for that, so you can go straight to it and see if that's what you were remembering.
Okay.
Or I might be off.
Thank you.
I think that another aspect of Alzheimer's and dementia that is not often talked about is the person that's going through this has a field of friends that they have been disconnected to, and that it would help if they can, if their friends would continue to reach out to them and call them or talk to them or come by and have lunch or whatever the situation may be, because it would help both parties, because the person that's going through it is feeling uh, alone, and their friends are being without. So I think that we don't talk about the association of their peers that they used to have. And I think that's important, that we want to maintain that contact in some form or some way.
That's really an important point. And we've heard that a couple with other families as well. Why do you think people might be hesitant to reach out and continue to connect with that person who's living with dementia or Alzheimer's or starting to show those symptoms?
I simply think it's just like when someone passes, you just don't know what to say. And I think sometimes people don't understand the progression of the disease and don't know how to be around the person that where they're repeating themselves, or they tell them something and they can't recall what they said. So I think it's just the uneasiness of being around their friend that has the disease, and they just don't simply know how to navigate that.
Me to see my friend go through this. It's hard on the one that's actually going through it. And if we have not been able to properly deal with that issue, and I think that's part of it too.
Yeah.
So I don't want to put words in your mouth, but do you think it would be helpful to have more opportunities for education, to talk, to see what could be beneficial to both parties? Or do you think it would be helpful to have more modeling, or what do you think would be helpful to you?
So I think all of that, what you just said, is helpful.
This is Tina Littleton. I'm with Ward, and my mother just passed away from Lewy antibody.
Very sorry.
And what I find is whole process is that before they even get to symptoms that says that there's something wrong, there's small degrees of things that we miss as family members and friends. Oh, they're just abstinent. Gosh darn, they're just cantankerous. But later on, I found out that there was more going on. And because of how prideful and how, she did not recognize that things was wrong. So I could not help her until the very end. And so I just believe that there needs especially in the African American communities, there needs to be more education. And I've been at Ward for over 30 years. They've had a lot of other things come in the church and talk about various things, but never has there been anything to deal with this quiet thing. And the only way I got help is I decided to start talking about it. And I found out some of my friends had dealt with it. And one friend in particular gave me information on how to talk to her, what to say, how to communicate. Because and understand the different personalities, because people that are very, some people don't want help, and you have to be able to talk to them a certain way to be able to get them the help they need. So I think there needs to be education from a beginning level, because there are a lot of people that are suffering with some type of mental illness that we as regular people diagnose them, or we have labeled them to be something other than what it really is. And there's no education. The places that I found were way out in Orange County and Santa Monica, and only a couple of places at that. So I believe there needs to be more education, to help us understand what to do, how to do it, how to help our loved ones, because we can't in and of ourselves.
You made some incredibly important points there. My follow-up question is, for such education, like, where would you like to receive it? Who would you like to receive it from?
Well, first I would, we go to the churches and we, politicians come and schools come, but when it comes to things like this, we don't talk about them. And I believe in the churches would be a good start. We go there for everything else, but the one thing that affects us, and we all suffer quietly, we deal with it. We don't understand, there just needs to be education. I believe starting in the churches would be a good way, because you are right. It does not just affect the person who has the illness. It can destroy a family.
Absolutely. Thank you so much for being so candid, Tina. I really appreciate it. And I'm so sorry for the loss of your mother and the loss of your years as a caregiver.
Well, you know what? I have to say, I thank you for that. But it has educated me in a way that I would have never imagined, not to be so judgmental. Because we don't, my mother's was always very outspoken. And we just said, oh, well, yeah, but not until the very end till it got further on, did I understand, wait a minute, something is drastically wrong. And so I think that, to get some education starting in the churches, from the grassroots, the things we don't talk about, the things that how we look at people don't know the importance of how to communicate with their loved one who is ashamed. They don't want people to know that they can't remember. They don't want people to know that there is something wrong. And the biggest lesson I learned, diseases of the mind are things we can't see. We can physically see that somebody has diabetes. We can tell they don't eat certain things or they got other things. But when it comes to the mind, that is the most fragile organ that we have, and people cannot see that. And I just believe that in our communities, there is more going on that people that are dealing with it than not. And if it wasn't for one of my friends who she got the information from somewhere, and she gave me a paper on what to say, how to communicate, don't argue, don't disagree, don't do this. It was only and she didn't feel embarrassed. So the churches, I believe, would be a good start, because quietly people will sit and say, oh yeah, that happened to me. We don't know the resources that are available. We don't know what is available to us as caregivers, and and sometimes maybe individuals who may recognize they may have some of those symptoms, but don't want to tell their family.
Absolutely. Tina, would it be okay if would you be interested in starting up some of those talks at the church, maybe with a little training? Maybe we could co-lead something. No, I'm just doing it on the side.
That'll be a side conversation for later.
Yes.
I love it. I'm in. Tina's in. I'm signing you up.
So I think, I mean, everything you say, Tina, is just so, I mean, I just 100% agree with you. And I think also, like, once we do start to recognize that maybe something is wrong, or also, like, what is the role of that healthcare system? I mean, we know overall for everybody, it's difficult to get a diagnosis, but what are you seeing within your church community, within your larger community? Like, what do, people don't talk about it, but when it does present, we can't ignore it anymore. Where do people go? Or is it easy to get a diagnosis or an evaluation? What are your thoughts on that?
And not just Tina, everybody.
Everybody, I'm sorry, yes.
I don't know about anybody else, but it has to start with the person wanting to get the help they need. And sometimes if we don't communicate it in a way that doesn't make them feel less than, or that we're just trying to throw them away, then they can't get the help that they need.
Well, I know with my friend's dad, the diagnosing part was the hardest part. They suspected he had dementia, but it wasn't until he had progressed into the disease that it was confirmed. Mm-hmm. So I think him receiving the type of help that he needed early on was missed because the diagnosis was missed. So I don't know what would help in that situation, but they ran different types of tests and it just was not showing conclusively that he had the disease, but it was evident once he was well into the disease.
Mm-hmm. And you're right. I think people do like to have that diagnosis label so they know what they're dealing with before they can kind of reach out for programs and services or even know what they're dealing with. Do you find most people do feel comfortable with their provider to have that conversation, or it just depends on the individual and, like you said, how you present, how the person wants to engage?
What I find from my friend, it's embarrassing. And he was out, neighbors would call her, he was wandering down the street. So I think it's an embarrassing situation, and I agree with Tina, it's just not talked about. Mental illness in our society is just not talked about. That's a conversation we don't have. And I think people are very private when their loved ones are suffering like that. But it was very difficult for the family, and it's been a huge strain on the family.
Yeah.
Deborah, can I just ask, when you say our society, are you referring to the African-American community specifically? Or
I think society and I think society in general, when it comes to people that are suffering from that, particularly when their cognitive ability has gone away, I think their families tend to shelter them and try to protect them just for their own, for dignity's sake, because it's a very debilitating disease in the latter stages.
Absolutely. And this is something we just are trying to also get a handle globally, but often when you go to your physician for your annual checkup, and you say, I feel like I'm having some memory issues, do you feel like you get support from your physician, or do you feel that is being dismissed? And this is for everybody.
When I was growing up, they would call that bordering on insanity.
Mm-hmm.
So how long has Alzheimer's actually been around? Because we didn't hear that when we were growing up.
Great question. It's been around for a minute. through the 20s earlier, but I would say in the last 20 years, the association has really pushed to make it a national issue, a national concern, to put it on the headlines of everything. We're seeing it now. You know, it's written into TV shows, it's written into movies, it's written into books, it's talked about more. As I mentioned before, they've pushed hard to get it as the diagnosis, as the reason for death, to get more awareness. You know, someone is diagnosed with this disease every 65 seconds in this country. But the notion of it still being, oh, that's grandma, she just has a touch of senility, is still very much present. So we've worked, every year we work harder to increase awareness, to increase funding, to increase research, to increase education, because it is such a huge impact. But I would say I personally have noticed it become more on the social radar, or on the public radar, in the last 20 years. You know, there was a Academy Award winning movie about how that movie is like 6 years old now. But I'm seeing it more and more as the topic of, or as a character in a book, movie, or TV show.
Yeah, this is Jackie.
Yeah.
I want to answer your question in a different kind of way. The state of healthcare in this country is such that getting a physical examination is not a high priority for most visits. It's handling a complaint. And often, if you, although Obamacare requires and covers a physical examination, all too often our people are going to doctors and is simply handling the complaint and not looking at an annual physical examination with all of the tests, the neurological exam and others. What I'm finding more is that people need an advocate, especially elders or persons who are more timid, to go with them to the doctor's office to ensure that they get what they need, especially if we believe that that person needs some of the mental status examinations and some of the other particular tests. And I think that's one of the openings to us who may not have someone close to us, that we will be an advocate for someone if they're going for a physical examination, go with them. Because we know once the doctor says something on the front end that's shocking, like it looks like you had a stroke, you don't hear the rest of it. So whatever the doctor is going to say about 100%. What you do about the results, somebody else needs to be there to hear it. And I think that's a ministry opportunity. I think with insurance, there's also an advocacy issue with Alzheimer's to help people, Alzheimer's Association, to help people understand some of the insurance coverage, because some of the people who market insurance for us will take people away from a very global plan that covers to another plan that doesn't cover many things. Some of the HMOs are just simply not as good, and others are just fantastic. Yeah. But even having a primary care physician is not as common as it used to be. Right. And I think those are the ways that the Alzheimer's Association can help people understand.
Role for that person with the physician. But what are some of what help would you need to also help support those who are living with Alzheimer's or dementia? You know, we talked about a little bit around communication.
Respite for the caregiver.
Explain to me a little bit more.
The caregiver often doesn't have anyone to stand in when they need to take a break or for assistance with some scheduled activities. Sometimes you can call them family and friends, but there's a time that you just need to be able to call someone and just know that that resource is available. And so I know it's a big issue with Alzheimer's Association, but I just want to put it out there because I think it's a problem that can get solved if we put all our heads together.
Yeah, and I think kind of what we've talked about in different conversations, it's also not necessarily that formal paid care, but kind of how do we provide networks of almost like a co-op.
Exactly.
So perfect, perfect. What else would you see that would help you? You as an individual, you as a member of your congregation, you within this health ministry?
I think it goes back to what we were talking about earlier about the education, especially like in the situation with my friend's dad who became violent, to the point where he punched a nurse and caused her nose to be bloody, just how to simply handle a person, how the family has to address those issues. So I think education. And also, I believe it was Sister Jackie that mentioned the right things to say, like someone that's forgetting not to say, I know you should remember, or something like that, just the right choice of languaging in dealing with our loved ones.
So I'll ask you this. If you said education, because I wrote it down 3 times, if we as kind of a society are also hesitant to talk about kind of changes that we're seeing in others, how would we kind of together approach delivering this education so more people are exposed to it, say, sooner rather than, oh my gosh, it's a crisis and I need it now?
Well, I think, for example, these types of platforms are very helpful. I know, as I'm thinking, I know in addition to the 2 people I mentioned, I know someone else that's caring for a loved one that has dementia. And I'm just going to share the information to have access to a 24-hour hotline for help that is confidential as far as the advice that's giving, for the website where they can go on and do some training that's free to start spreading the word. If we go to a movie and it's good, well, COVID times where nobody's going to the movie, but we spread things about good food, our restaurants, all of that. So we need to start spreading this amongst our family and friends. So it's being educated and just spreading the word by mouth and having platforms like this where we can attend and making the information available to us.
I don't know how often this particular type of platform is available, but I think that the more platforms like this, then the word get out more. Each of us probably know somebody who can benefit and appreciate this type of a platform. And if we knew when the next one was going, we can direct them to that. So I think that just the schedule of platforms like this is helpful to the Alzheimer's Association and reaching out to everybody.
I'm going to challenge the members of the Southern California Labor Organization. Since we've had 2 workshops that brought information, how does this fit into us taking action? Because the intent was that we would go back to our local congregations, and maybe 2 or 3 congregations, our local congregation would do something. So how does this take us to the next level? Because one of the things that we want to do is not just gather the information, but do something with it.
Well, I accept the challenge. I'm president of our missionary society. We actually have a meeting on tomorrow. We'll be sharing the information about this presentation with them. Our lay organization is just getting started, and I will be sharing that. So for one, I think when you know people that are going through it, you're more passionate about it. So I, for one, accept your challenge and will share it. And I think I was just brainstorming as I'm listening. to just maybe quarterly, monthly, whatever, to have presentations like this, to just make it available. And those that are willing to come, even if it's 5, we reach 5 people. So I accept your challenge, and thank you for making that challenge.
I like it.
To that point,
this is Dr. Burnett. I'm putting into the chat the unofficial announcement about the Connectional Purple Sunday to be held on March 21st at 1 p.m. Pacific time. And that will be the launch for Purple Sundays at our local levels, which will be another arm of disseminating information so that it will launch. What we're hoping is Purple Sundays will launch programs for those churches that have not been involved at this level.
What time was that again?
1 p.m. Pacific. The save the date, Beverly, you're on. The save the date will be ready next week, correct?
That is correct. That is correct. And we're looking forward to having more churches be to the association in areas across the country. So I think this is a great start, and glad to be on this morning listening to your feedback and what you have to say about the resources and what's available in communities and how we can help. So thank you all.
Sister Beverly, I think you need to introduce yourself and let us see your face.
Good morning. I'm Beverly Berry. I am the Associate Director of Diversity Outreach and Community Engagement for the Alzheimer's Association for the Home Office. And I've been working with the AME, Dr. Burnett, and many others from the AME community so that we can help make resources available, hearing from communities. This is one of the great things that we do through this process, is listening to communities. And I'm so thankful for Sister Jackie, Susan, Ms. White, and all of the others that have helped to bring this together, because this is the work that's important. It's how we're able to make moves and to provide those resources. So thank you all so much.
And this is Susan. I just want to dovetail to that. Your feedback is very kind of important and taken with a lot of consideration. I actually have been taking notes, and I'm now on my 3rd pen because I've run out of ink. So we are really trying to kind of hear what you're saying and really be able to be kind of responsive as well. So I also noticed the times. So I want to be respectful of everybody's Saturday morning. So I don't know if there are any other final thoughts anyone would like to share, where people get information, how the Alzheimer's Association can be of better service to you, your church members, your community, or this is just going to be the first of many conversations.
Well, I have a question. In thinking what would be helpful if there were some type of a short video, or I'm thinking of a presentation, maybe 20 to 30 minutes, that if we wanted to present to our groups, if that were made available to us. And secondly, if we wanted to have a speaker, say come to one of our meetings, come to our church or whatever, if we had a contact person where we could reach out and ask for that, if that were made available to us.
So I put my email in the chat. Please reach out to me.
Okay. All right.
Thank
you. And thank you for this.
We are working on actually I'm being filmed on the February 1st, as a part of our video. So that is coming. Sorry it took so long, but it's coming.
Thank you.
Sometimes we have to wait for good things to come, so that's okay.
And
I just have a timing question though. Do you think people are more interested quarterly? Like if they did an educational series, would you like that once a month for 3 or 4 months, or once a week for 3 or 4 weeks? Or would it be do you think you'd get more people interested during church time, or like fall on the heels of, like right afterwards? What do you think some of the optimal?
Well, I think we can work to try to make something available that people can, local congregations can say, hey, I'd like it scheduled at this time. So if we have a menu, I think of what's available, that would be good. And then if we have the resources that Sister Deborah is talking about, that people can simply go to when they need them, like the other places on your website. If she's going to have a meeting or gathering and believe it's going to be helpful, well, she's just dealing with someone, and let's just pull it up on the phone, because now they're open to that discussion. I want to put something on the table, though, that I've already discussed at length with Susan and everyone else. You know, we live in a multicultural society, but we have to really remember that racism is still alive and well. And so it is very, very important for the materials to come to us in a package culturally sensitive. So we will sometimes receive things much better from somebody who we believe has our walk. Feel they can relational and they can actually open up more, because beyond the information, we want to get to the heart. So we want to get to the head and the heart and get to the action. So I think the two things here today, the information we need for ourselves, family, and friends, and the information we need to do impactful ministry in our community.
We are developing.
Extremely important.
Yeah, I completely agree. Beverly and I just had a text message exchange about the same. We are developing a speakers bureau that includes many of the neurologists and neuropsychiatrists around the country who look like us, as well as we already have co-branded 25, I lost the number because we keep rolling them out, brochures and handouts, and the new clergy guide that will be released with the Purple Sunday is by us for us.
Right. And so I want to say partnering, Yale, is important when we go in. It doesn't mean that the information is not the same and valid. But sometimes it's who says it. I'll just use an example and then shut up. I cannot tell you, because I was trying to get people to consider the vaccine, how many people were saying heck to the no, and citing the Tuskegee study. More people of communities of color that were willing to look at the vaccine. And more people were able to remember. We couldn't remember AstraZeneca and Pfizer and anything else. But I tell you, people are asking, where's Moderna? Because Dr. Corbett said, I've been doing this for 7 years. And she looked straight into the camera and said, to the people who look like me, I had you in mind. And I would not recommend anything to you that I wouldn't take myself. And it was huge.
100%.
So we live in a society where that has value and that has capital. And I think with Alzheimer's, it is still as important. Even just the idioms in which we describe what's going on and how we label everything. So I think the partnership is important when you go out and when we go out to communities of color. And it's more important than language.
Much as I don't, I love this conversation. I think everyone probably has other plans for their Saturday. So we will be sending you in the near future from, I believe, Jackie, a survey. And that is going to be another opportunity for you to share feedback. If you think of something tomorrow that you forgot to mention, this is that opportunity. Please feel free to contact the SCCLO to start up an Alzheimer's ministry. Yael's contact information is on the screen for you to contact her for follow-up questions, resources, etc. And then we're just looking forward for you to kind of, both of us kind of join each other's mission in moving this kind of topic and this momentum forward.
Because it's something you're supposed to do with what you were able to glean today. If you have an uncomfortable night, just know you're still hearing God's voice. We're thankful to Dr. Burnett, who is my partner in crime and this condition, dementias, extremely important. And so I would ask Mr. Bridgewater, our conference chaplain, if he would please